Section 1. Platelets, guardians turned traitors in the battle against cancer. Platelets, tiny cells in our blood, are best known for their role in stopping bleeding. When we get a cut, platelets rush to the scene, clumping together to form a clot that seals the wound. This vital function, however, can be exploited by cancer cells, turning these tiny guardians into unwitting accomplices in tumor growth and spread. Imagine a bustling city street where platelets are like vigilant traffic cops, always on the lookout for damage. Cancer cells, in this analogy, are like cunning criminals trying to evade capture. By disguising themselves with a coating of platelets, these rogue cells can slip past the body's defenses, remaining hidden from the immune system's watchful eye. This platelet camouflage allows cancer cells to travel undetected through the bloodstream, increasing their chances of reaching distant organs and establishing new tumors. This process, known as metastasis, is a major hurdle in cancer treatment, as it significantly reduces the chances of successful therapy and survival. The intricate relationship between platelets and cancer cells is a double-edged sword. While platelets are essential for wound healing and preventing excessive bleeding, their ability to protect and transport cancer cells presents a significant challenge in the fight against this complex disease. Section 2. A protective shield: how platelets mask cancer cells from immune surveillance. Our immune system is a powerful defense network, constantly patrolling for and eliminating threats like viruses, bacteria, and even cancerous cells. To do this effectively, the immune system relies on its ability to recognize foreign or abnormal cells. This recognition process is based on specific molecules called antigens, present on the surface of cells. Cancer cells, however, are masters of disguise. They can evade immune detection by hiding their unique antigens or by suppressing the immune response altogether. One way they achieve this is by recruiting platelets to form a protective shield around themselves. This platelet cloak acts like a Trojan horse, masking the cancer cell's true identity from the immune system's watchful eyes. Imagine a wolf in sheep's clothing. That's essentially what cancer cells achieve with the help of platelets. This disguise allows them to move freely throughout the body, evading the immune system's attacks and increasing their chances of survival. This intricate interplay between platelets, cancer cells, and the immune system highlights the complexity of cancer development and progression. Understanding these interactions is crucial for developing more effective cancer treatments that can overcome these evasive mechanisms. Section 3. Platelet power, fueling the metastatic journey. Metastasis, the process of cancer cells spreading from the original tumor to other parts of the body, is a complex and multi-step process. It is often the most challenging aspect of cancer to treat, as it significantly reduces the chances of successful therapy and long-term survival. Platelets, unfortunately, play a critical role in facilitating this dangerous journey. Not only do they provide a protective shield for cancer cells, but they also provide essential growth factors and signaling molecules that promote tumor cell survival, invasion, and establishment in distant organs. Think of platelets as providing a starter kit for cancer cells to thrive in new environments. These kits contain everything from the tools needed to break down surrounding tissues to the blueprints for building new blood vessels that will supply the growing tumor with nutrients and oxygen. This active participation of platelets in metastasis highlights their multifaceted role in cancer progression. It underscores the need for therapies that can target these platelet-mediated mechanisms to effectively control tumor growth and prevent the spread of cancer cells throughout the body. Section 4. Dipyridamole. Unveiling the anti-cancer potential of an old drug. Dipyridamole, a medication originally developed to prevent blood clots, has recently gained attention for its potential anti-cancer properties. This old drug, new trick story, is particularly exciting because dipyridamole is generally safe and well tolerated, with a long history of use in clinical practice. Unlike traditional chemotherapy drugs that directly kill cancer cells, dipyridamole works by targeting the intricate relationship between platelets and cancer cells. It disrupts the ability of platelets to bind to and protect cancer cells, effectively removing their protective shield and exposing them to the immune system's attacks. Imagine dipyridamole as a decloaking agent, stripping away the camouflage that cancer cells rely on to evade detection. This allows the immune system to recognize and target these rogue cells more effectively, potentially slowing down tumor growth and spread. This novel approach to cancer treatment, focusing on disrupting the interactions between platelets and cancer cells, holds promise for developing more effective and less toxic therapies. Dipyridamole, with its established safety profile and emerging anti-cancer potential, represents a promising candidate for further investigation and clinical application. The anti-cancer potential of dipyridamole is not just theoretical, it's backed by promising results from laboratory studies and clinical trials.
In melanoma, a type of skin cancer known for its aggressive nature and tendency to spread, dipyridamole has shown encouraging results in preclinical studies.
These studies demonstrated that dipyridamole can inhibit the growth and spread of melanoma cells, both in the lab and in animal models.
Furthermore, clinical trials exploring the use of dipyridamole in combination with other anti-cancer therapies for melanoma are currently underway.
These trials aim to determine the optimal dosage and treatment regimen for maximizing the anti-cancer benefits of dipyridamole while minimizing potential side effects.
In breast cancer, another common and often aggressive type of cancer, dipyridamole has also demonstrated promising anti-cancer activity.
Preclinical studies have shown that dipyridamole can inhibit the growth and spread of breast cancer cells, particularly in models of triple-negative breast cancer, a particularly aggressive subtype with limited treatment options.
These findings highlight the potential of dipyridamole as a novel therapeutic agent for various types of cancer.
Further research is warranted to fully elucidate its mechanisms of action, optimal dosage, and long-term efficacy in different cancer settings. Statins, a class of drugs widely prescribed to lower cholesterol levels, have also emerged as potential players in the fight against cancer. These drugs, typically used to reduce the risk of heart attacks and strokes, have shown some anti-cancer effects in laboratory and observational studies. The potential benefits of statins in cancer are thought to stem from their ability to inhibit certain enzymes involved in cell growth and proliferation. By interfering with these pathways, statins may slow down the growth of cancer cells and potentially reduce the risk of cancer development or recurrence. However, the evidence supporting the use of statins for cancer treatment is not as robust as that for dipyridamole. While some observational studies suggest a link between statin use and reduced cancer risk or improved outcomes, these findings need to be confirmed in large-scale, well-designed clinical trials. Furthermore, statins can cause side effects, such as muscle pain, liver damage, and increased risk of type 2 diabetes. These potential risks, along with the lack of definitive evidence for their anti-cancer benefits, warrant careful consideration when evaluating the use of statins in cancer patients. When comparing dipyridamole and statins as potential anti-cancer agents, several key differences emerge. Dipyridamole's primary mechanism of action involves disrupting the interaction between platelets and cancer cells, effectively removing their protective shield and making them vulnerable to immune system attacks. Statins, on the other hand, target intracellular pathways involved in cell growth and proliferation, potentially slowing down the growth of cancer cells. However, the evidence supporting statins' anti-cancer effects is less robust than that for dipyridamole, with most studies being observational and requiring further validation in clinical trials. In terms of safety, dipyridamole has a well-established safety profile with a long history of use in clinical practice. Statins, while generally safe for most people, can cause side effects such as muscle pain, liver damage, and increased risk of type 2 diabetes. Overall, dipyridamole, with its targeted mechanism of action, promising preclinical and clinical data, and favorable safety profile, emerges as a more promising candidate for further development as an anti-cancer agent compared to statins. Section 8. The dilemma of dipyridamole and statin errors in cancer care. While both dipyridamole and statins hold potential as anti-cancer agents, their use in oncology is not without challenges. One significant concern is the possibility of medication errors, particularly in patients already taking multiple medications for various health conditions. Dipyridamole, often prescribed in combination with aspirin for its anti-clotting effects, can interact with other medications, leading to potential bleeding complications. Statins, too, have a long list of drug interactions, which can alter their effectiveness or increase the risk of side effects. These potential interactions highlight the importance of careful medication reconciliation and open communication between healthcare providers and patients. Patients should be encouraged to keep an updated list of all their medications, including over-the-counter drugs and supplements, and share this information with their doctors and pharmacists. Furthermore, healthcare providers need to be aware of the potential for drug interactions and take appropriate steps to minimize risks. This includes prescribing the lowest effective dose, monitoring patients closely for side effects, and providing clear instructions on medication administration. Section 9. Navigating the Future. Research and Personalized Approaches. The potential of dipyridamole and statins in cancer treatment is an exciting area of ongoing research. Large-scale clinical trials are needed to confirm their efficacy, determine optimal dosages, and identify potential biomarkers that can predict which patients are most likely to benefit from these therapies. Personalized medicine, an approach that tailors treatment to an individual's specific genetic makeup and tumor characteristics, holds promise for improving the effectiveness and safety of cancer therapies. By identifying patients who are most likely to respond to dipyridamole or statins based on their tumor biology and genetic profile, we can maximize the benefits of these drugs while minimizing the risk of side effects. Furthermore, combining dipyridamole or statins with other anti-cancer therapies, such as chemotherapy, radiation, or immunotherapy, may enhance their anti-cancer effects. Clinical trials exploring these combination therapies are ongoing and hold great promise for improving cancer outcomes. Section 10. Empowering patients. Understanding platelet-targeted therapies. As our understanding of the intricate relationship between platelets and cancer continues to evolve, it's crucial to empower patients with the knowledge and tools to actively participate in their care. Patients need to be aware of the potential role of platelets in cancer progression and the emerging therapeutic strategies that target these interactions. Open communication between patients and their healthcare providers is paramount. Patients should feel comfortable discussing their concerns, asking questions about their treatment options, and reporting any side effects they experience. Furthermore, patients can play an active role in managing their health by adopting a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques. These lifestyle modifications can not only improve overall health, but also potentially enhance the effectiveness of cancer therapies. Section 11. Conclusion. A call to action for improved cancer treatment strategies. The discovery of platelets' multifaceted role in cancer progression, particularly their ability to shield cancer cells and fuel their metastatic journey, has opened up new avenues for therapeutic intervention. Dipyridamole, with its ability to disrupt these platelet cancer cell interactions, represents a promising anti-cancer agent with a favorable safety profile. While statins have shown some anti-cancer potential, their evidence is less robust, and their use is associated with potential side effects. Further research is crucial to fully elucidate the anti-cancer mechanisms of both dipyridamole and statins, determine their optimal dosages, and identify patients who are most likely to benefit from these therapies. The future of cancer treatment lies in personalized approaches that tailor therapies to an individual's specific tumor biology and genetic makeup. By combining these targeted therapies with lifestyle modifications and supportive care, we can strive to improve outcomes and enhance the quality of life for cancer patients. The journey towards more effective and less toxic cancer treatments requires a collaborative effort from researchers, healthcare providers, and patients alike. By working together, we can translate scientific discoveries into clinical practice and pave the way for a brighter future in the fight